Hey, everybody, welcome back to Dentistry Unmasked. My name is David Rice. I'm the chief editor at Dentistry IQ, along as usual with.
Hey everybody, Pam Maragliano-Muniz. I am so thrilled for this week's episode. I love clinical topics. I'm in my office right now, like worked all day, all the things. And so there's nothing better than chilling with your friends talking about restoratives. So this week's guest obviously requires no introduction whatsoever, but I'm so happy you're here. Dr. Bob Margeas, welcome.
Thank you so much, Pam. Dave, great to be with you both today. And it's always fun to be talking about dentistry, but I first want to commend you. What you've been doing at Dental Economics is amazing. I'm very proud of you. I read that magazine, and you should be proud of what you're providing out there. So I just want to make that known that I am an avid dental economics reader.
Oh my gosh. Well, this is the Mutual Admiration Society. So feeling is 100% mutual with what you do at Inside Dentistry. So
Okay.
thank you.
You're
So
welcome.
I'm going to say, kind of like start this off in the sense that we were talking. I got to talk to Bob yesterday. So, like 2 days in a row for me, which is awesome. We were chatting and we were talking about sometimes you go to lectures, and sometimes it's true, the lecturer promotes products or techniques that they don't actually provide themselves, which is not good, but it's out there and it's true. And Bob was mentioning during his lectures that he invites his attendees, like he challenges them. He's like, hey, man, if you don't believe that this isn't what I use day in and day out, you can stop by my practice anytime, like an audit, and look in the drawers of my operatory to see that what we're working on today is what is in fact in my drawers, which I think is so amazing and so admirable. So I have to kind of start with, all right, let's pretend David and I like knocks on the door of your operatory and we're like, what is your go-to?
Yeah, you know what? It's only happened one time, Pam. So when I'm lecturing and I start out say, "Hey, as a speaker, do I have my opinions and biases?" And I kind of shut up, and people are like, "What's he going to say?" And I said, "Yeah, I do. I do have my biases. I'm biased towards what I use in my practice. But as you know, and Dave, as you know, we're fortunate because as key opinion leaders, we do get a lot of materials from different companies. Is that right?"
True
Yes,
story.
indeed.
Yeah. And so, like what you said, Pam, maybe a product that you use that you may not particularly like because maybe you like a composite that spreads a little bit like butter. Maybe I like one that's a little bit stiffer. Dave likes one that brushes. So when we speak, it's not categorically necessary that one particular product is the best. It may be the best in your hands. And so when I make that statement, I say, listen, I talk about what I use, and what I use is just my personal preference. Doesn't mean that what you use is inferior, but if you really want to know what I use, you can stop into my office unannounced. Don't call and say I'm coming on a Monday, Tuesday, or Wednesday. I'm in the office Monday, Tuesday, Wednesday, then I'm off for a week, then I come back Monday, Tuesday, Wednesday. Just show up in the office or call Shelly and let her know that you're going to be coming. And one guy drove down from Duluth, Minnesota. I was lecturing at the Star of the North in Minnesota, and he comes in on a Monday. He goes, "Hey, I'm here to see what you use." He goes, "Well, I'm just kidding. I actually wanted to watch how you do work." But I said, "Come on back, look in my drawers and see what I use." And he came back and I said, "This is what I use. Am I not using what I say that I'm using?"
That's fantastic because it's so easy for people to stand in front of a room and just share a lot of what they want to share. So I'm curious, Pam, I'm going to rephrase this differently, but so Bob, what's in your drawers?
Well, I have a lot of different. Listen, thank you. Well, I have a lot of materials that I've used, and over the years, I've used a number of different composites. I've used Renamel from Cosmodent. I've used 3M, Filtech Supreme. I've used some Tokiyama products, and over the last 3 or 4 years, I've been using a product from Clinician's Choice called Evanes. Why do I use Evanes? Are those other products still great? Yes. I mean, can you get a polish better than a microfill? Absolutely not. Microfills hold their polish, but there's some inherent problems with microfills too if you're not backing it with a hybrid or a nano. But I was, fortunate over the years to work with Peter Jordan from Clinician's Choice, and he said, "Hey, we're coming out with a composite. What do you like about composite?" I said, "Well, if you want to really go after market share. Make it like Filtech Supreme, but maybe a little stiffer." I see Dave shaking his head, Pam shaking your head.
Yeah.
It's like that has 40% of the market share. Why? Great shades, great handling, great polish, and it's a strong material. So, probably Evan-S is what I've been using as my go-to composite. But there's other ones. Omnichroma. I've used Omnichroma in certain situations. I have it in my toolbox as far as, hey, for some particular cases, it works really well. And so, there's so many on the market. I use some of the Venus products from Heraeus, Venus Diamond, Venus Pearl, their one is a very, very nice product. So I have a number of in my drawer for composites.
So let's talk about Evan-S, for example, because even with Filtech, I feel like a lot of people use it universally, but I mean, there's no perfect composite
Yeah.
system out there. So we could just like get that out there. But I feel like sometimes you want a stronger, stiffer composite, but then maybe it doesn't polish as well. Or, vice versa, you've got something that polishes beautifully, but you get these little chips if it's not supported properly. So what is it about Evan-S that you like so much?
Well, you know what? First off, I was able to kind of help with the development of the handling and some of the shading and stuff like that. I was not paid by Clinician's Choice to do that. They sent me samples, and I would say, "Hey, I like this," or "I don't like that." And the thing about Peter Jordan is he listens. He doesn't take it personal if you don't like something. But with Evan-S, I mean, it has a dentin shade. It has a universal shade. It has enamel shades. It has effect shades, sort of like, let's say, Filtech Supreme has their body shades, has their dentin shades, and have their enamel shades. So if I wanted to use it as a universal, I would use a universal shade. If I was not going to do multi-layering using a dentin shade, enamel shade, and effect shade. And when I say effect shades, I'm talking about like an enamel white or a clear translucent or a incisal translucent. Those would be the effect shades. So if I'm using multi-layering, I'm getting paid a good fee. I'm going to want to use maybe a dentin shade, enamel shade, effect shade. But if I have a Delta Dental fee, I may use just the universal shade. And I like the fact that those shades, match the Vita Shade Guide really well. So that's one reason why I like it. It polishes well, handles well. And if you're doing a diastema closure, I don't want something too sticky because if I'm doing a pull through technique, I want that material to move. And it's a stiffer material, so that's one reason why I like that material.
You said something, you said a lot of things that are really awesome. And I know we're going to kind of dissect all of that a little bit, but I'm guessing you two share in experiences where sometimes dentists come up and say, well, I love that particular composite, but it's priced too high for this segment, and not this segment. But I love that you share, like, you know what? My go-to is my go-to. How I work with that go-to may be different if I'm working on a Delta dental patient or somebody that I'm going to put 4, 5, 6 different shades on the tooth. But your workhorse is your workhorse. And I think it's a really important take home for us not to compromise the material, but maybe just the technique we use to streamline our efficiency.
Yeah, that's a great point, Dave, because if I'm going to do a multi-layered composite and I'm going to get paid a Delta Dental fee, you just can't really do it because it's all based on time. So I literally say, "Hey, how picky are you?" I ask, "How picky are you?" "I'm very particular." "Well, this fee is going to be what it's going to be because it's going to take me long. I'm going to use 4 or 5 shades." Now, I can give you a great restoration, great polishability, pretty good match. May not be perfect, but I'm going to use 1 or 2 shades. Boom. And that's the restoration you're going to get because that's what I'm getting paid. Too many dentists are concerned, like, you want to be a lecturer? Okay, take all day, do one composite, videotape it, film it, and edit it, and do all this, and you can be a lecturer or use Michelle Monnier as your laboratory and make no money on the case. I'm more about this is what I do in my office. This is how I make money. This is what I teach.
So that brings me to one. I just have to reminisce for a second because when I finally, which is like silly that I didn't meet you before this conference, but we met at an event, and you were on a panel, and there was like all of these people that were like talking about their, oh, I charge these crazy fees for these crazy restorations and all of these things. And you were like, no, it's not practical for a private practice. And if you want to have a successful practice, happy patients where you see more than one person in a day, you have to be practical. And so that was one of my like favorite segues into meeting you, because I was like, oh my gosh, I love him before I even met him. So like now I think that people need to understand that there is a practicality factor that sometimes is lacking, and but not with you. And I love that. And I love how genuine you are with your teaching, and with, just even being so open about the materials that you share and that you present with. Now, are these also the materials that you work with? You give a lot of hands-on courses. So if somebody's like, oh, you know what, that sounds cool, but I don't want to commit to buying it yet. Is this a way that people can learn and kind of get their hands on the product and play with it?
Yeah, no doubt about it. Because when we do like hands online live, it was a thing when COVID hit. My wife was like, you're not going on the road or anything. And I got stuck in Detroit one time and I couldn't get to Boston because of the snowstorm. So we literally set up my iPhone on a tripod and I literally was recording, doing the procedures through my iPhone through QuickTime Player to that club. And so I'm saying, gosh, she said, you ought to just do this hands-on line live. And we form that with Clinician's Choice. So people can take a course in their office. Now, you don't want to use Evanescence, go ahead and use a composite that you're using because it's more of a technique. These are the results I can get with this particular composite. But if you're using a Filtech Supreme or Tokiyama's Omnichrome, or you're using, Estelite Omega, the concepts are still there. And so it allows people to try the materials out without committing to it. And it's pretty inexpensive, maybe $250 or something to take the course and follow along. And Pam, we talk about doing hands-on courses. I like the fact when I'm doing a hands-on course, I'll say, how many people have tried Evanescence? I don't want the people to have tried it. I want them to try it here and then have their own opinion of it versus if everybody's tried it, if everybody tried, you see how many people have used Filtech Supreme when you're doing a hands-on, half the room goes up and they may not learn as much. I'm not here to tell them what to buy, or I'm not here to promote the particular product. I want them to be their own, advocate for it.
I love that. How when you do those hands-on lines, are they on demand? Do you run them certain points of the year where they're all live?
Yeah, you know what? It's both, Dave. We do live events where they send out a kit. It's pretty ingenious what Peter Jordan did. Based on my wife's concept. They send a kit out, so the kit contains the model. It contains the instrument I use. It contains all the composites, all the polishers, everything you need to do a class 4 restoration, and you keep everything. And so you can watch that live feed for 30 days. Or let's say you don't want to do it live, you can actually watch a recording. You can pay to have a recording and they can send you the kit and you do it on your own.
Love it.
Yeah, I think it's great. I mean, there's another friend of mine, Dennis Hartley, who's done great stuff with his dental online training that, is a similar concept, but it's more of a recorded type thing. And so there's so much continuing education and the ability to have it out there that I find that younger dentists, they're more online or more, opt to not leave and spend the money to go to some of the, continuums.
Well, let me tell you this. Like, I take a lot of hands-on courses, and I take a lot of hands-on composite courses because, like, if I can die and come back as you or Newton Fall or something, like, I'd be so happy. So I feel like there's nothing more annoying than taking this course, being so inspired, doing all the things, and then I come back on Monday and they set up for a composite. And I'm like, oh no, I don't use that anymore because I took this course. And now I have 12 seconds to try to summarize what I just did in the past 4 days to my team. So to have hands-on courses that you can take in the comfort of your own practice
Yeah.
with your assistants there, and they're learning with you and they're seeing why you're doing these techniques and the benefit of bringing this technique to your practice and to your patients. That right there is magic, because it's so hard to sometimes bring those, and try to get them back on, on up to speed with all the things you just learned,
Yeah.
when they've never seen these products. They never saw that matrix. They never saw the pull through. They didn't and they're just like watching you like, what are you doing now, you nutty professor? It doesn't have to be that way. So I think it's genius. I love that.
Yeah. And one trick is this. You can't take one hands-on course and think you're going to be a master. When you read all the books on how to become a master, what do they say? 10,000 hours. And so when I'm doing this program and I've done this so many times on this model that it better be good, or it better be close to and I'm going to tell you, I still practice. My associate, I'm in my lower level of my teaching center, and I'm doing these plays. He goes, why are you still practicing this and that? Well, I said, because you want to be good. You got to be able to do it regular. And I remember at the Kois Center, I was doing a class 4 live, and I was doing the live in front of all these people. And who was my assistant? John Kois. And Kois is like blowing the air on my thing, and I'm doing the finishing and polishing. And as I'm finishing, the disc kind of caught the corner a little bit and made my embrasure not as good as what it was. And John's going, God, I hate when that happens, you know. And it can happen. So when you're doing it live, and I get a bubble or something, it's good for teaching, because if it's perfect every single time, it's not really reality. So sometimes when I'm doing the program, I kind of call it your 3-card Monty. They see you do the hand piece, you hold it, and then they try to do it, but maybe it's not quite as good because they haven't practiced stuff. So my advice is, once you learn it, go back and practice and practice and practice.
I think it also makes us feel good that if you get an air bubble, it makes me feel like less of a loser. I'm like, if Bob Margeas can get an air bubble, I can get an
Anyone can
air
get one.
bubble too. Exactly. And I'm like, that always, I personally appreciate that. Now I'm just going to throw it out there. I mean, this is Dentistry Unmasked, right? And we like to cut through the BS. How does somebody identify, or like kind of get, when they're taking a course, if they're getting a course by somebody who's really not using the product, like how do people identify that? Because I think I like taking real courses from real people who, who this is what they do. And this is why I can expect to do this predictably. Not everybody can kind of cut through that. Like, do you have any recommendations for people to identify, where they're going to get like real good, legitimate CE from legitimate CE providers?
Yeah, Dave, I want you to go in on this one too when I get done. It's really difficult. It's so difficult to know where you're going to get the best. Now, I do believe hands-on is the best. Why? Because you can't learn to play a piano by watching a lecture. You don't learn to swim without doing it. Now, the question becomes, are they trying to sell you product? Are they trying to sell you all of these different, materials? And I say this, you take a hands-on course, and now you have these tints to buy, and you have these incisal shape. And literally, I have them sitting on my shelf after taking a course. And I'm using expired tints from like 2020. If it light cures, and because you don't need much, and it cures, I'm gonna use it. Now, a guy like Newton Fall, I don't care what material it is. He can use Tokiyamas. One day he can use 3Ms. Another he can use Ivoclars. It doesn't matter. Some of those people are just inherently talented. I had to kind of work to get better at it. And so I would use recommendations from colleagues who have taken courses versus just looking online, because there's so many opportunities out there. How do you know you're going to take a course? I want to use an example. Back in the 80s, my former partner was placing implants from the 70s. When Brandemark came out and they were doing root form implants, he wanted to do it. But Brandemark, Nobel would not sell to a non-prosthodontist or a periodontist or an oral surgeon. GPs couldn't do it. That's when Jerry Nisnik came out with Corvent. So Paul went and took a Corvent course, and when he went there, All they tried to do was sell him the implants, the equipment, this and that, and not teach him really the way they do it. So he wrote a letter and said, listen, I'm so upset about that. I spent my money coming out to LA, took my time off, and all you want to do is sell me something. So they ended up having him go back and take another course. So I've done that too. It's hit and miss. I think you almost have to take recommendations from colleagues who do a lot of CE and go from there. Dave, how
That's
about
great.
you? What's your
Yeah.
experience with that?
Great point. I think it's very much how a patient finds us. They ask people they know really well, they trust, and who've been through the experience. And I think, pulling back a concept you mentioned earlier, it's not that there's not a lot of young, really talented people, but sometimes the folks who've been maybe educating a little longer um, are sustainable because they educate. So it's not a knock on somebody who is
Yeah.
giving their first course. And maybe that's not the best indicator to see who they're going to be in 5 years, 10 years, where the three of us could easily identify, who's been in this game 10, 20, 30 years is still standing because they love to teach. And it doesn't matter the material as much as the technique, and the material gets plugged in because it's something that works well in our hands. And I think people who, even when they have their favorite, speak to other excellent materials in the same category
Yes.
because it's about the lesson. And I'm with you. And Pam, I've heard you do this 100 times. Here's the technique. Here's what I love. Here's some other amazing people. And if you haven't used them, use them too. Go home and practice with them too. See what works well for you.
Yeah. You know what makes me insecure? I'll tell you what makes you insecure is Instagram. I'm
Oh,
looking at I'm looking at Instagram. I'm looking at some of these composites and what they're doing. Listen, I know my ego's not that big. I thought I was good. I was good at one time. I'm still good, but there's some people that I'm looking at that, wow. And I will say one thing for me, seeing students who are better than you makes me feel good. I don't have to be the best. I look at a guy like Marcos Vargas. Marcos Vargas from the University of Iowa. Listen, he was a grad student of mine at Iowa. When he came, he was talented, but I've never met somebody who is not only a clinician, a faculty instructor, and a researcher. He's all three. I'm pretty good at teaching, I'm pretty good at clinician, but I'm not a researcher. He is a total package. So I want to learn from people who are out there and doing what I call, Dave, live, and Pam, live demonstration. I don't want to see a video that was edited and you don't show your mistakes, this and that. I want the mistake to happen. If you're doing it live, hey, this is what can happen. Oh, I did a pull through. I got a little void. Let me show you how to fix the void.
yeah,
And that's where you learn the best.
100%.
I think that's
Yeah.
incredible. So, what about this? We have some younger dentists that are following our podcast. And I think, like you said, Instagram can really make you feel bad about yourself. And I think that people are young dentists or they graduated from dental school and they go from like a foundation
Yeah.
to trying to do the 5, 6 layer composites.
Yep.
What's your advice? Like, what's a proper trajectory? Because I can't help but think if you can get the form down and the anatomy down, then like you start to play with layers and doing all of those things second. So, I mean, that's kind of what I would think would be like a nice segue to that. Do you have advice for somebody who wants to get to, these Instagram restorations, but they're kind of starting out and they're, kind of feeling the pressure of private practice, but want to get to that point?
Yeah. Listen, I love the fact that we have not rehearsed anything here. We haven't asked questions. You took my thunder because all of a sudden, yes, it's about form and shape. If you get the color right, but the shape is wrong or the anatomy is wrong, it's not going to look good. How many times you had a patient that had 6 veneers and they had recession on one tooth, and you tell them, "Hey, we need to cover that," and they say, "Well, it doesn't bother me because when I smile, I don't show it." And then you put the veneer on, they give them a mirror, and they smile big, and all of a sudden they see that tooth. It's all the same shade. The shade's the same, but the color, the shape was wrong. You hit the nail on the head. You got to work with the primary anatomy, the secondary anatomy, tertiary, then get the layering and stuff down. Get the foundations of the shape, contour, polish, and then you can start working on layer. You start to layer, but you don't all of a sudden, by the time you get your final layer on, you're already too far out. When you come back and finish and polish, you polish back into your tints. So I think what you said was perfect. Get the shape, and then what you have to do is you have to continually practice. I've been practicing 38 years, but I still pick up a handpiece in my teaching center and practice, you know?
You know
all
what
the
works for
time.
me? I mean, I'm old school in a way. I guess I'm an old soul. Like, so I've been a dentist for 20 years. But you know where I learned the most? With wax. When I'm trying to wax up a composite case and I'm doing this, that is really where I'm planning everything and realizing what what my challenges are with form, what's going to work, what's not going to work in wax. And I feel like I'm so much more prepared when I do my own wax ups. I don't always do them all. In fact, I do them fewer and fewer, which is probably a good thing for the practice, but not a great thing for me. But I feel like that's where I really play with it. And then I'm like mentally in the game, ready for when it's go time in composite.
Can I geek out and tell you like a digital version of that?
Yeah.
I, Also, true confession, how I like to help myself feel worse about myself is sitting down with great lab techs, great ceramists in exocad and looking at a patient and saying like, what if we did it this way and this way and this way? It's incredible to me like what we can digitally wax or plan and like help me decision tree of, wow, if I went that direction, here's the five reasons it's never going to work before I ever touch a patient. It's humbling to me because to learn that technology is, I'm still trying to figure out all the things my iPhone does, but my lab techs know it really, really well. So that, baby steps, I'm learning. But that's so true, Pam. The more time, and Bob, like the more time we spend when our patients aren't present, learning about all the things that can happen when they are, the more we're prepared to get ourselves out of situations and hopefully even dodge a few situations that we would put ourselves in.
Totally agree. Really. That's so important. I mean, and when you said lab techs, I learned more from a guy, Uri Yarovsky, who owns Opus One, and Ed McLaren, lab techs, anatomy and surface texturing, than some of the other dentists that I've taken courses from.
Great point on texture too, like all the cool things we can do in composite.
Yes,
So amazing.
it really is. I like the fact, Pam, that you still do wax ups. I
Oh,
really do.
yeah.
I mean, it makes you so much better to see because you can't see it, you can't do it.
True.
Absolutely. Also, I think sometimes, which I mean, we all see it good, bad, and different on Instagram. Sometimes you should consider ortho, or sometimes you can't just make a fat tooth to close a diastema. And, it's so much better to work that out in wax ahead of time. I also find, especially, so I do a lot of mock try-ins too. And so, again, easy to lengthen a tooth in wax, not as easy to have to lengthen it in composite. So, I find it's just easier to work out any question, especially when it comes to ratios and widths and all of those things in wax before you're sitting here fumbling. And certainly I could never do a composite by hand again. I need a matrix.
Yeah. And when you talk about orthodontics, to me, orthodontics is the best value in dentistry. I draw a line in the sand. If this is a crooked case but the teeth are perfect, I'm not going to do the case. I want them to do orthodontics. I call veneers, and I've been doing veneers for 36 years. I call it destruction for production at times. If I've got to prep into the dentin, I'm more concerned that that longevity isn't going to be as good. I want to look at a case and know that it's going to be there in 20 years. It's good to show that, oh, look at beautiful before and after, but sometimes they don't show you their preps. What do the preps look like? And then it's this. Buddy Mopper said this best, you guys. He said you can't call yourself a cosmetic dentist if you only do veneers, porcelain. Because if you only do porcelain, you're just a cutter and a paster. And your laboratory makes you look good. Direct composites, you're a true artist.
Man, I still remember the first Buddy Mopper course I took in like 93 in DC.
Yes.
Long story we don't have time to get into, but yeah, if you can master the direct restorative game, then the rest of this dentistry is a little bit easier to do. So crazy. Pam, I don't know why we even mentioned we might not have things to say for 30 minutes because it's been 30 minutes and we're just cranking by here. I, I don't know how it happens, but so Bob, when's your next course or where are your next courses? How do people reach you? How do they get in touch and learn from you? Because they need to.
You know what? When COVID hit and we did the hands online live, Steve Phelan, who I think is an excellent educator, he came to me and said, "Hey, I want you to do a composite mastery course." So, oh God, I don't know if I really want to do it. He goes, just put all your lectures online. And listen, I never promote myself, and I don't want it to sound commercial, but Marcos Vargas and I do a composite mastery online course where people can they pay a fee. They have 10 modules that we have. We have like 120 hours worth of content. They pay a yearly fee. And then once a month, we do a live webinar and we show cases that we did in our office. So we do cases and then we do live demonstration on the visualizer and they can ask any questions that they want. These are like 3 to 4 hour once a month, but it's just composite mastery online.
I love it.
I'm
Thank you
obsessed.
so
I'm
much.
signing up, Pam.
I am too. Yeah,
No
no,
joke.
no,
No joke.
same. No, that's
Yeah.
no. Yeah,
You guys are too kind.
no, for
Too
sure.
kind.
Wow. Well, thank you so much for your time and thank you for hanging out with us. This has just been incredible. And I just, guys out there listening to this, like you'll never hear more real things, than from Bob Margeas. So I'm so glad you joined us today.
Thank you guys so much. It's been a pleasure. It's so comfortable. It's like comfortable talking to you guys because when you tell the truth, you don't have to remember anything that you said. And I listen. I've known about you before I met you. It was as at that summit. You just didn't know it. I mean, I've been following what you've been, Dave. I don't talk to you a lot when I see you and stuff, but you guys are doing fantastic things. I'm proud of both of you. Keep up the good work.
Thank you so much. It's we
Thank you.
we just keep seeking out great folks like you. So
Well,
Pam, you want to like wrap us up? And
No, I want to stay.
I do too. Like, can't we just keep going?
Oh my gosh, I totally
How
want
much
to.
trouble could we really get in? I mean, it's kind of our show a little
It's
bit.
our podcast. We can do whatever
Yeah.
we want.
Damn it. We're gonna keep talking. No.
We're going to keep talking. No. Oh my gosh. No. Thank you so much for your time. And everybody out there, thank you so much for joining us. And please follow us and continue to listen to us next week. We can't wait to see you then. Dr. Bob Margeas, thank you for joining us. And everyone, we will see you all next week. Bye.
Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.